Hi, my name is Kelly. I'm a pharmacist from Kaisa Pharmacy. Today I'll be sharing some information regarding stroke. A stroke, or sometimes called a brain attack, occurs when something blocks blood supply to part of the brain or when a blood vessel in the brain bursts. In either case, parts of the brain become damaged or die. A stroke can cause lasting brain damage, long-term disability, or even death. The brain controls our movements, stores our memories, and is the source of our thoughts, emotions, and language. The brain also controls many functions of the body, like breathing and digestion. To work properly, your brain needs oxygen. Your arteries deliver oxygen-rich blood to all parts of your brain. If something happens to block the flow of blood, such as a blocked artery or a ruptured artery, brain cells start to die within minutes. This is because the brain cells do not get enough oxygen. This causes death to the brain tissue due to hemorrhage or bleeding, which then causes a stroke. There are two types of strokes, the ischemic stroke and the hemorrhagic stroke. Most strokes are ischemic strokes. An ischemic stroke occurs when blood clots or other particles block the blood vessels to the brain. Fatty deposits called plaque can also cause blockages by building up in the blood vessels. A hemorrhagic stroke, on the other hand, happens when an artery in the brain leaks blood or ruptures. The leaked blood puts too much pressure on brain cells, which damages them. High blood pressure and aneurysms, which are balloon-like bulges in an artery that can stretch and burst, are examples of conditions that can cause a hemorrhagic stroke. A transient ischemic attack, TIA, is sometimes called a mini-stroke. It is different from the major types of stroke because blood flow to the brain is blocked for only a short time, usually no more than 5 minutes. Symptoms of a stroke can vary from patient to patient, but they have one thing in common, which is they come on very suddenly. People are fine one moment and then suddenly may have symptoms. Symptoms include confusion or difficulty in speaking or understanding, difficulty in swallowing, sudden loss of vision, sudden numbness, weakness or paralysis of the face or on one side of the body, sudden severe headache, and unexplained dizziness and loss of balance. If you suspect someone of having a stroke, be fast, recognize the symptoms, and act fast. Does the person seem to have a loss of balance, headache, or dizziness? Does the person has a sudden loss of vision in one eye or both eyes? Does the person's face look uneven? Can the person raise both of his or her arms for more than 10 seconds? Is the person's speech slurred, or does he or she has a difficulty in speaking? Call an ambulance immediately if you suspect a stroke. You can save a life. You do not need to go on a very strict diet or do vigorous exercises to protect your heart and lower your risk of heart disease and stroke. Take small steps every day towards a more heart-healthy lifestyle. And the best part is that being more heart-healthy also lowers your risk of other diseases like cancer and diabetes. You need to get enough aerobic activity to get your heart pumping. For example, at least 30 minutes a day of brisk walking, and do muscle strengthening activities at least 2 days in a week. Reaching and staying at a healthy weight will lower your risk of cardiovascular disease and stroke. If you already have heart disease, a healthy weight will help you control your disease and prevent heart attack. A slow and steady weight loss is the best way to lose weight and keep it off. Always check with your doctor before starting any regular exercise that you are not used to doing. Making unhealthy food choices can lead to weight gain. But that is not the only risk. Unhealthy eating affects your arteries, blood pressure, glucose level, and many other parts of your heart health. Talk to your doctor or pharmacist about a heart-healthy eating plan that lowers your risk of a heart attack and stroke. Stress, anxiety, depression, and lack of sleep can raise your risk of heart disease or stroke. Take care of yourself with these steps. Firstly, get enough sleep. Most adults need 7 to 9 hours of sleep each night. Do not stress. Keep stress in check by taking time each day to relax and unwind. And lastly, treat mental health problems. Get help if you have trouble coping because of depression, anxiety, or other health problems. If you smoke, get the help you need to quit. If you drink alcohol, do so in moderation. If you smoke, recognize the signs and symptoms of heart attack and stroke and ensure that you know what to do when you encounter someone or even yourself developing a stroke. Make sure your friends and family too are able to recognize the symptoms. Knowing the symptoms and getting help quickly can help you survive a heart attack or stroke and avoid long-lasting brain damage, long-term disability, or even death.